help my son, help with a lot. Okay, what you're going through are actually my specialties. And I'm going to break them down a little bit different than you've been broken them down to. Okay, first of all, heart surgery. Heart surgery is a lot on a child. Now, I just need to know more details, and then I can give you a better Facebook Live. Did they do a full crack on the sternum? Is it wired shut? Or is it a partial, or did they go underneath? And you would know. Because a child's not meant to have surgery for a couple of reasons. One of the best organs that we have is our skin, our epidermis. And our epidermis is there to regulate gravity and go all over these things. And so that expand and the contract, like when we breathe. With heart surgery, especially when it's a chest cut, right? Now you tend to have a more retractive breath, because again, it's harder to push that sternum with gravity. And also if the sternum's been cut, and to do it that way, do they have to open the chest up? Sorry to get so graphic, folks, but this is what happens to our munchkins and to adults. So I need to know the breakdown specifically, because my biggest specialty is I wouldn't say undoing medically. I actually just worked on a mom today that was sepsis, and I'm like, I don't care, you're coming on my table. And thank goodness it just worked out that she can get some time on my table, because there's no way that she could have undone what happened to her, right? And it was my pleasure, and that's just who I am. The other thing is, okay, and I'm gonna tag up another video. You're not meant to have friction in the womb, right? The womb is there for you to expand in all directions. So what I'm curious about, and I think this is why you have the confusion of the Duanes and the Jouberts with the vision and so forth, is that cyst. The cyst, when there's a cyst and so forth, it puts a different weight on biology. And you'll see it when I talk about with the plants and stuff, where I put the beads on and how the plants have that friction, right? And so I think what's going on, because the where it was within the brain system, is that's more, even though it disappeared or it merged out, is still throughout the development there. And that's why you're going to get that teeter-totter. So with the Duanes, what I need from you is this visual report. Are we just dealing with Duanes, or are we dealing with visual acuity? And I've got to make sure that they checked your son for vision. You can still have Duanes and Jouberts and need glasses. And lots of times they're so perplexed on the structure of the eye, which is the Duanes, that they're not looking at the global that you need, which you might need also glasses. You can still have glasses and still have Duanes or Jouberts. So, but we don't want to lose the eyesight. If the eyes are actually physically fine, what you're going to do for his vision to improve it is going to change, versus if you need glasses and how we're going to approach vision. So I'm going to give you two guidelines on that, and I just need more information from you. And then when you're working with here, what you're also missing, when you don't have that convergence, right? Where Mateo's also weak with is the pubic bone strike. So when he's walking in the pelvis, and that's why you're almost hanging him with walking, is because his legs are scooting here versus a step and a step, because his eyes don't step in that sense. And that's where the shake of the eyes, for lack of a better words, coming in. And yes, the tilt is there to stabilize, and we have to, again, work with that, because we don't want the tilt eventually to be into like a scoliosis, because he's fixing the eye. I had a 10-year-old with double cataracts, and that's how I caught her. They brought her in for scoliosis, and I'm like, what the heck is going on with her eyes? And she was going blind. And so we're working with the cataracts as well as that. So that's what we're working with. I'm going to bump up, like I said, I just did a live last week on this, on tumors and infections. And that's what I want you to look at. And just get me the other information, and we'll get a better story to help you. Thanks so much. And I really appreciate your post.